I am really excited to introduce our speakers today who are going to share some of the work of the eSchool Plus initiative here at Hopkins. And we have with us here today two of the founding members of this initiative, Dr. Ruth Faden and Dr. Annette Anderson. Dr. Ruth Faden is the founder of the Johns Hopkins Berman Institute of Bioethics, and she served as its director up until 2016. She's currently the inaugural Philip Franklin Wagley Professor of Biomedical Ethics, and her research focuses on structural justice theory and on national and global challenges in food and agriculture, learning healthcare systems, women's health, and vaccine policy, which clearly is a very hot topic right now. She has undergraduate and master's degrees from University of Chicago and University of Pennsylvania, and both her MPH and her PhD are from UC Berkeley. So thank you for joining us, Dr. Faden. We also have Dr. Annette Anderson, who is an assistant professor in the School of Education and Deputy Director of the Center for Safe and Healthy Schools. On a side note, which is very important, she is a native of Baltimore and a graduate of Baltimore City Public Schools. Besides her research interests, she has served in a variety of school-based positions, including teacher leader, curriculum coordinator, assistant principal, and operated multiple university partner charter schools, including Henderson Hopkins. So she has undergraduate and master's degrees from Georgetown University and Syracuse University, and a master's and a PhD from University of Pennsylvania. So Annette, thank you for being with us today. I'm really excited that you're both here. And I want to just take a moment to set the stage a little more for you, as I was very fortunate to be able to work with these amazing women on the eSchool Plus initiative. And I am partial to how this interdisciplinary initiative sort of came to be. So it was late in February 2020 when Dr. Faden, in response to a comment from the CDC about the possibility of K-12 school closings in the US, wrote an op-ed in the Sun and stated that just like in all public health emergencies, poor children and poor families will suffer the most. And she was basically calling on folks to ensure that active measures to mitigate the disproportionate burden will fall on the most vulnerable children. And in response to that op-ed, a lot of folks were ready to meet that call. So Dr. Faden and Dr. Anderson, who represented Berman and the Safe and Healthy Schools centers, and Dr. Megan Collins, who is a third founding member of the eSchool Plus initiative, but was not able to join us today. She represented the Consortium for School-Based Health Solutions. They brought together this group of faculty from across the Hopkins Schools of Education, Public Health, Medicine, and the Berman Institute of Bioethics. And it's a great group of people who had interest and expertise in ethics, in equity and structural injustice, education, school-based healthcare, food security, and public health policy. And I would say that those first few months of working together, where there was no funding and very little sleep going on, were a complete blur. And somehow this team managed to develop resources for schools to support students during school closures, which at the time was impacting 50 million K-12 students nationwide. So by the end of April of 2020, we had published a school closure response checklist and a tracker that summarized how different districts were responding to school closures. It focused on continuity of learning and health and food security and supervision and housing and safety. We hosted a series of webinars around learning losses and parent choice and reopening, school-based health, and other school-related topics that were connected to the pandemic. And as is the story with most of the public health response in COVID, we had to quickly pivot from school closings to school reopenings. And through all of this, and particularly in the projects that'll be shared today, equity in school responses to the pandemic was the common thread through all of this work. So I'm going to turn it over to Dr. Faden, who will share a little bit more about the initiative, and then she'll turn it to Dr. Anderson.
Thank you, Beth. So if it isn't obvious, Beth is a very pivotal part of our faculty group that kind of met the call. Other people that you may know, Sarah Johnson, who's in the School of Public Health and the School of Medicine as well, and Ellen Regenberg, who's primarily in the Berman Institute. And others, but sort of people who've been doing the heavy lifting, plus a remarkable group of undergraduates and graduate students, some of whom end up getting paid, some of whom ended up not getting paid, postdocs at the School of Education at the Berman Institute, all of whom have been part of the small army of people that have worked hard, as is true of Hopkins faculty, the Hopkins community everywhere when it comes to this pandemic. I think we have a lot to be proud about as part of the Hopkins family and community. So I just wanted to step back a little bit and say something about equity that is the sort of stage setting for the entire project. And I feel like I am so preaching to the converted when I talk to the faculty and students and fellows of this department. But I'm going to do it anyway, because it's lovely to say this to a responsive audience. I often say it to a less responsive one. There's a double play in terms of equity that is at issue when we talk about kids in a context like the pandemic. The first is, I like to make the case that children, in contrast to people in other stages of the lifespan, are actually ethically special, right? We have special equity obligations to kids relative to the rest of the population. And I think that's terribly important and needed to be made front and center from the beginning of the pandemic, especially in the early days when we were sighing with relief, looking at the fact that kids and adolescents were doing relatively well, medically speaking, from the clinical challenges and the clinical consequences of becoming infected with COVID-19 virus. So why worry about kids if kids are actually doing better, quote unquote, if the burden of disease is not so present in children as it is tragically now? And the argument why they're, from an equity perspective, kids are special takes two forms. There are two good reasons, and you're going to completely, I hope, resonate with both. The first is that children are children, and they are dependent on adults, the adults in their immediate family units or in their caretaking environment more broadly, teachers and pediatricians and pediatric nurses and so on, for their well-being. Even as they get older, we all know that kids lack both the authority and the resources, the authority and resources to take care of their own interests, and the judgment. So kids are really dependent on all of us for their well-being. And that sets a kind of ethical cascade for why we have special obligations to children. And in the context of the pandemic in particular, we had to sort of own, that is to say, all of us who are not children or adolescents own the fact that whatever happened to kids as a consequence of this pandemic was everybody's fault but their own, right? The one group that could not be held responsible for what might not go well for children and adolescents in this pandemic are the children and adolescents themselves. So that's the first line of ethics defense for why children are special that really mattered in this pandemic and matters always. The other has to do with the pivotal importance for lifetime well-being of what happens in childhood and adolescence. And this is where, hats off to your department, to so many of the colleagues and former students and fellows who've generated the evidence base that supports the conclusions around the importance of what happens in childhood. But we know now empirically, and this has incredibly important moral overtones, that what happens in the early stages of life and into adolescence has an outsized impact on the life prospects, the possibilities of people having decent lives of a reasonable length as adults. So if we screw up, which is what your department is so about trying to prevent, if we screw up the experience in childhood, we undermine, right? Not only what happens in childhood, not only the suffering in childhood, but basically lifelong. So if you put the two together, you have a really powerful ethics argument, an equity argument, why children have special claims relative to the rest of us in terms of health policy and public policy more generally, as well as, of course, in personal and social life more particularly. Now, then there's the second sense of equity, right? That is the health disparities part that so many of us are also incredibly committed to, that is within the group of children. Obviously, not all children are situated similarly in terms of their life prospects. And here, right, the life prospects for children from communities of disadvantage, whether it's disadvantage because of poverty, whether it's disadvantage because of ethnic racial oppression, current and historical, whether it's disadvantage because of gender identity or disadvantage in terms of ability, in terms of developmental or other abilities, those children are going to have an outsized, yet again, outsized negative impact, right? Anything, and this is what Beth was signaling, we just know, it's just written. It's like scriptural. When bad stuff happens, right, whether it's a natural disaster or it's a war or it's a pandemic, right? The people who suffer the most are the people who were already disadvantaged, and within that, the children especially. So when we started the eSchool Plus initiative, it was with an eye on both, with the recognition that we really needed to pull out children, that there was so much concern and worry that was associated with the epi-evidence that was supporting the disproportionate burden in terms of severe disease and death on older Americans, all incredibly important to know from this perspective of public health policy, but that an eye needed to be trained on the children, even as, right? Even as all the evidence was supporting the incredibly high priority we needed to place on protecting older adults, right? And then within that, the eSchool Plus initiative was especially interested in shining a particular spotlight on kids of communities of systematic disadvantage. So that's sort of the ethics backdrop to the sort of whole project. And with that, I'll turn to Annette to share a PowerPoint and give you a deeper dive into the nuts and bolts of what Beth and I have been referencing. So, Annette,
absolutely. So, hello, everyone. As Dr. Faden has really put into place our theory of action as a group. And so much of what we did in response to COVID was really based and founded on Dr. Faden's argument around the importance of children and the ethical considerations that we needed to make in particular for children. So I'm going to share a little bit about some of the products that have come about as a result of this investment. And so we have, we've been thinking about what it means to be safe and healthy through this pandemic. Oh, it's going pretty fast now. So I want to see if I can stop it. So as we shared, the three of us started having these initial conversations, Dr. Collins and Dr. Faden and myself. And as we were having these initial conversations, we were really trying to figure out what schools needed to be able to respond to the notion of closing safely and in a healthy way, and also in terms of addressing equity, as well as in what it would need to reopen. And so we have built a great team, including, as Dr. Faden said, Dr. Marshall, Dr. Sarah Johnson, Alan Regenberg, many others who continue to support this work. So one of the things that we really had to think about in reopening was how the pandemic in particular was going to affect our most vulnerable children. As Dr. Faden said, those who have been systematically disadvantaged the most. So we had to think about how we could develop resources to help support both state and local policymakers to make decisions to look at reopening from both an ethical as well as an equity-focused perspective. And we have a website, equityschoolplus.jhu.edu, where all of these products can be found. So if you're interested, you can go right to the website at equityschoolplus.jhu.edu to see more of this information for yourself. The three things that I'm going to very briefly touch on today, and then we'll open it up to conversation, are the state reopening dashboard. That was a big piece of our work last fall, as well as last spring, our teacher vaccine dashboard, and the big project that we are currently engaged in with the World Bank and with UNICEF is our Global Education Recovery Dashboard, or GERT. So one of the things that we did early on was to try to agree on what the equity-focused and ethically focused categories would be in terms of reopening. We knew that there would be some conversations about some of these core academics and COVID-related operational categories, but even as we started to think about what reopening would look like, and we knew that we were going to be building out a state reopening tracker, one of our biggest roles was trying to figure out what we wanted to look at in the state reopening plans to gauge equity. And so we decided on these 6 categories: parent choice, teacher and staff choice, children of poverty and systemic disadvantage, children with special needs, as well as twice exceptional and ELL, privacy and engagement and transparency. And then we also had these other 6 categories that you see on the left side of the screen that spoke to some of the day-to-day operational issues that we knew that needed to also be covered in order for schools to reopen in the fall of 2020. So we gave credit to districts and to state plans if they addressed it. We did not necessarily, we didn't have a value associated with how good those plans were or how strong those plans were in each of those 12 categories. What we were basically trying to do was to figure out who was actually trying to address these themselves as a state, and to look at how the equity issues that were embedded in those state reopening plans actually were able to accommodate all of the concerns that we had around things like digital technology and additional instruction time and accommodations for parents, special education supports, thinking about after school instruction and Saturday school, for example. And so we looked at equity through the lens primarily as looking through the category of children of poverty and systemic disadvantage. And we knew that we wanted to get a sense of how states were addressing that. So our state reopening tracker from 2020, again, it's on our website if you want to take a look at where we were with that. And so much of that information has been archived, and it is very informative. One of the things that we saw is that when we started this journey, some states had some of those categories covered very well, and many of the states had not covered all of them very well. And so this map was intended to look at, on a scale from 1 to 12, how states were addressing the reopening challenges embedded with COVID. And so when we looked at last July, our first opening review of these states, and we looked at 50 states as well as some territories as well, we saw that there were only 16 states that were addressing all 12 of the categories, both the operational categories as well as the ethical and equity focused categories as well. And so we saw, well, there was a challenge because many of the states had not picked up all of those categories that we knew were going to be important for our most vulnerable children. By September of 2020, which is when we gave most schools across the country to be open, we saw that that number had nearly doubled, that we had gone from 16 to 30 states addressing all 12 of those categories in their reopening plans. And so we saw that there was some sense that states wanted to go back and figure out what else they needed to address in their reopening. And so some states that had not in the earlier form addressed that in a later form of their state reopening plan. So you can see here that when we compared the categories from both July of 2020 as well as September of 2020, you see that there is an increase overall. As I said, we had 51 plans in July, and we bumped that up slightly to 54 by September. But what you really start to see is that there's a shift on this equity side, that more of the states really began to embrace the need to address these equity and ethics questions. In particular, the issues around parent choice. So parent voice has become one of the key responses to the school reopening dialogue. And so we saw that back in July, that only 37 of those states and territories were addressing that in their reopening plans. But by September, 51 of the 54 states and territories that we were investigating had addressed it in their reopening plans. And likewise, we saw that children of poverty and systemic disadvantage, which we also said was a key category, only 35 of those states had addressed that initially in their reopening plans. But we saw that that number increased by September to 47. So we saw also a substantial increase there. So more of the states were reckoning with their need to address this equity, this open equity issue during COVID. The issue that we saw, though, that continues to be a challenge was teacher and staff choice. So when we looked at the reopening plans initially in July, it was the least covered topic among the 51 plans that we had at the time. Nearly half, just about half of the states that submitted plans showed that they had made teacher and staff choice a priority in their planning. And then by the time schools reopened in September, we saw that that had increased from 27 to 36. But as you can see here, of all the 12 categories, teacher and staff choice was still the least likely to be addressed in a state reopening plan. And so we know that this is an ongoing conversation, even today, as teachers and staff in schools continue to talk about things like burnout and needing additional supports in the midst of this reopening. But that trend, we started to see a thread line even back through last summer. So the other thing that we've been looking at as a part of eSchool Plus has been looking at the return to school through the availability of vaccines for teachers in prioritizing access to the vaccines. So while right now this is, we heard today, saw an article that about 85% of teachers here in Baltimore City have already been vaccinated. Back in February and March, we weren't quite sure what the vaccination status of teachers were going to be and whether there would be a state by state prioritization of eligible vaccines for teachers. And so we took it on ourselves back in the late winter, very early spring, to look at what the vaccine plans were for teachers so that we could start thinking about the correlation between vaccine availability and prioritization and the reopening of schools for in-person learning. And so while the Biden administration, they kind of got to us before we could really report out on all 50 states, we were able to show that there were many states that had early on begun to prioritize teachers for vaccines in hopes of trying to reopen schools for this fall, but also for last spring as well. And so we do have that dashboard and that data historically archived. And then the last piece that I wanted to talk about today is our global education recovery tracker. That, as I said earlier, that is a product of our collaboration with the World Bank as well as UNICEF. And if you go to the website, you will be able to see all of the different maps and graphs, as well as blog posts and data, as well as the methodology behind how we are tracking the global response to school reopening. We have now had 16 rounds of data collected on our global education recovery tracker that launched again last spring in March. And so we've been able to look at what about 200 countries, slightly more than 200 countries, have been doing in response to school closures and now school reopenings. And if you go to the website, you will get an opportunity to really investigate and interrogate how schools across the globe have approached reopening and what the current status of reopening is. So you'll have a historical perspective as well as the current picture of where schools are. And as you can see, that the response to school reopening has not been in lockstep with what we've done exactly here in the United States. So it's very interesting to look at how hybrid education looks, for example, in some of the other high-income international countries, as well as the low and mid-income countries, as well as looking at things like extended breaks, where that has happened in several countries, or schools that have been closed, countries that have completely closed because of COVID and have not yet reopened. One of the things that was interesting to see is that for many of the low-income countries, that they have used technology like radio and packets in order to try to reach students. when they have not been able to reopen. We are also tracking, as where it's available, the vaccine priority for teachers on this site. So please make yourself, make a note to visit this website so that you can see how global reopenings are going, because it's interesting that as we have looked at the potential for learning loss, and we've talked about that so much here in the United States, but this is a much more global perspective, and seeing that there are students who are still out of learning months after many of the schools across the United States have reopened for in-person learning. It suggests that we have a long road back to getting all of our students back to in-person learning. And so, for example, if you look here, you can see that some of the countries that are reporting different types of reopening and ways that they've addressed additional educational supports, including things like changing the school day or the school year calendar, also thinking about adding additional supports like tutoring by teachers or nonprofit organizations or volunteers, and also thinking about other options. For example, in some countries, they have extended the school year so that those countries can try to have a catch-up period this past summer for students, since they were closed for in-person learning for much of last year. And then for remote educational supports as well, you can see, as I said, that there are lots of different options that have been provided where remote education still exists. For example, there are online platforms in many of the high-income countries where the internet is still available, but in low-income countries where there has not been sufficient access and availability of high-speed internet and devices, there have been other modes of instruction, such as television and radio, take-home packets, as I've said, and then tutoring and mobile devices. One of the other things that you'll see when you visit the GERT website is that we have monthly blog posts. We've just put up the latest blog post, to which I was a co-author. And so you'll see that there are different blog posts to inform our stakeholders, both here in the United States as well as globally, about the efforts to reopen our schools and some of the challenges that we are facing in the effort to get every child back into a classroom. We have these blogs, in addition to the blog posts, we also have these weekly posts that we share out on social media. You may have seen me share these out, as well as some of my colleagues within our group around what is happening lately, because as I said, we have been doing these data draws every 2 weeks. We have new data reported from over 200 countries. And so as you can see here, you can look at what some of the most recent findings have been. In this instance, we're reporting out that 95% of the countries are using the internet as a remote learning option for students during this pandemic. And also you're seeing here that we talked about that, the difference between the low-income countries and the high-income countries and the upper middle-income countries. And as the school reopening continues to chug forward for students. And then finally, this other last piece of data shows that 26% of the countries in sub-Saharan Africa are not relying on the internet as a remote learning support. And so those countries are using some of the other modes that I shared earlier. And so we're keeping an eye on that, because we know, again, as Dr. Faden said, all of this points to the need to track equitable school reopening so that we're closing any potential learning gaps for all students across the globe. As schools reopen, here are some things that we continue to be concerned about from a research perspective. Looking at housing as education policy, we know that housing and eviction policies have been drawn to the fore for many students, especially this fall. And so we have to think about what kinds of impacts that could have on the attempts to close any learning gaps in our march towards equity. Also things like teacher retention. And we're seeing, other challenges, I should just say, not just teacher retention, but staff retention. One of the biggest surprises for people who are not in the education space has been that we've got a bus driver shortage nationally. But for those of us who've been in this space, we've had a bus driver shortage. And so as you start to see education policies that are starting to incentivize paying parents to drive their children to school, we see that staff retention in education is going to continue to be a pressing issue, because when those gaps in hiring and retention occur, it more than likely affects our most vulnerable children. And so those are the children who get long-term subs, who are not highly qualified. They also are the same children that are often put on buses where there are more students than should be on a bus, for example, or have to be rerouted, for example, because we don't have enough bus drivers. I believe that in Prince George's County, they were saying that they need about 200 bus drivers today in order to meet all of the quotas for their daily bus schedules. And so we're seeing that this is a pressing need. Teacher retention and staff retention coming through this pandemic will continue to be an equity research issue. Instructional quality is something that we are also looking at, as well as assessments. We know that most districts have been mandated to give both academic assessments this fall, as well as social emotional learning assessments, so that we can figure out how our children are doing. And so as these assessments are being given, it will help to inform the instructional quality. But again, as you go back to what I just mentioned, when we have our most vulnerable students who are already thinking through issues like whether they're going to be housed this fall and winter, as well as going to schools where they may or may not have consistent instructors in their classrooms, and also have to think about having classroom aides who may not be available, or bus drivers who may be available. You can see that all of these issues are interconnected. And then finally, I would say we've got to continue thinking about not just planning for fall, but planning through the rest of this academic year. And one of the other issues that I think continues to come up in this reopening has been around safe and healthy schools, around school resource officers, quite frankly, because even today, we just are hearing today that there was a stabbing at Annapolis High School in Anne Arundel County. And so there's this concern as we talk about social emotional learning and the return to school of what our children are facing in terms of culture, school culture, in the return to school, and also having strong capacity to deal with students who have struggled. We have not necessarily talked as much about the struggle, the social, emotional, and mental health struggles of many of our young people as we have reopened our doors. And so the ongoing argument about whether or not we need to have school resource officers in schools or out of schools continues to be part of this whole equity conversation. So with that, I will stop and say thank you, and I'll stop my share, and then I'll turn it back over to you, Beth, for next steps in our conversation.
Sure. I first just want to highlight a couple things that came up in the chat, just some clarification. First, on the school reopening tracker, can you talk a little bit more about what it means when we look at parent choice or teacher and staff choice?
Sure. But before, Beth, can I do one thing really quickly? I forgot a person who needs a super shout out. We all did, and that's Andrew Nicklin, who is the Centers for Civic Impact, which is a wonderful resource at the university. And Andrew is the genius behind the cool stuff, especially on the Global Education Recovery Tracker. So that's just, I don't know if Andrew's listening, but if you're there, we could not do this without you. So go, Andrew. Annette, do you want to take that question, or should I take that one?
You can take it, help yourself.
So,
I'll follow you.
Choice is evolving over time, right? The choice question in the spring of 2020 turned on whether teachers had and staff had the option of being able to have assignments that kept them at home, or whether they were going to be compelled or lose their positions if they to teach in an in-person setting. So it was all around whether teachers and staff would have some control over their lives. So just think about in our world now, where we're trying to think through whether, staff need to come in X days a week, or whether they can choose that, or whether they're told that, and whether faculty, students, all that kind of stuff, apply that to the staff context in terms of reopening. As the pandemic has morphed and our mitigation practices have enlarged, the world has enlarged, the question about vaccines now looms large, right? Will teachers and staff have choice with respect to vaccine? I'm going to stay normatively agnostic for a moment about whether they should have that choice, but it's an issue whether they should have that choice. And it's staff as well as teachers, and the same now with mask policy. so whether there should be compulsory mask requirements for staff or not. The same flips over to parents. Should parents have control over what kind of educational experience their kids have, essentially make their own risk budget decision about whether being instructed in a school building is on balance in the best interests of their children and their families, right? And this was a story obviously very present in the spring of 2020 as schools started to go toggle back and forth. It's now a big story again, and Annette can speak to this. There are ethnic and historical sort of splits on this question of whether schools were ever safe for my kids or were ever a good place for my kids. And I'll let Annette speak to that because she does that so eloquently. But as we continue into this, we're seeing this slip in two directions. Parents who want some control if their schools do not impose a mask or vaccine mandate, and parents who want some control if their schools do impose a vaccine and mask mandate. That is to say, they don't want to send their kids to a school that has these mandates. So what options should they have? Should the public schools subsidize them with online education? Or is it only in the reverse, or is it not at all? So we're having those normative debates play out about how much teachers, staff, and parents should have control over their lives and their kids' lives versus public policies being made for them in the interest of, say, wider public health goods. So that's what that's about.
And I would only add that I think one of the challenges going forward is that many parents have come through this pandemic having found their voice in this conversation. And so it's great to me because parent voice has really informed a lot of the decision making to which schools have had to respond. And I think that it has shifted the dynamic somewhat so that we're not in a space where schools are saying, this is what we're going to do. I think the challenge is that schools are bound by resources and they only have finite resources, even with CARES Act funding. We know that schools have tried to accommodate as much as they can parent choice and parent voice in this conversation around reopening, but parents want greater access. They want more opportunity and they want more choices as we go through this next year. Make no mistake, even though we are back in school in person largely across the country, we have seen seismic shifts, for example, in the number of parents and parents of color in particular who are homeschooling their children. We are also not sure that all 100% of the students who were in school in March of 2020 have returned. And so it will be very important for us to get the September. So tomorrow's count is the September 30 count that we will look forward to seeing how many of the students across the country have actually returned and whether all 55 million students have returned, because what we have started to see is that as parents have had choices by opening up learning pods and learning centers and homeschools, for example, you're seeing more and more parents who want to exercise choice over how their children get educated. We've also seen an increase in the access to things like virtual schools and virtual academies. And so parents are starting to exercise their choice in that way as well. And so it is shifting the landscape of public education, and parents of color, and particularly parents who are parents of children who would be deemed more vulnerable. Those are the parents who have tended to be speaking up more. And that has been great in this dialogue, that parents who have traditionally felt that they have not had much voice have come to the front of the conversation.
Thanks, Annette. There are a couple questions in the chat, and so I do want to, I'm going to just lift them up for you. One is just a clarification on the Global Education Recovery Tracker. Can you talk a little bit about what it means when it's categorized as mixed or versus hybrid?
Yeah,
so
go ahead.
You take that. I'm sorry, you take.
No, go ahead. It's fine. We do this a lot. Go ahead.
Well, I was just going to say that, so a hybrid environment means that students attend some school, some part of their school week in person and some part of it virtually. And then there are other schools that are offering layered instruction. So rather than having certain days, they're also offering, for example, students can have their instruction in packets, as well as taking some of their coursework in a virtual environment. So that it just depends on how, and you remember that every school is going to be organized differently. And so as states are responding, or in countries, I'm sorry, as countries are responding to how they're offering education, they're trying to be as inclusive as possible to all of the different options that they are currently offering. So it may be that their country is offering hybrid between both in-person and remote or virtual. But if it's mixed, it includes both hybrid, but it also may include some of the other things that we mentioned, like radio or packets, for example.
And just in addition, when we're characterizing, so we've had lots of conversations about how impossible it is to characterize or understand what's going on in schools at the state level in the US, right? So now imagine what it's like to try to capture what's going on in a country, say the size of India, and describe it. So these are crude, sort of crude characterizations, and mixed also includes a country that would be doing fully virtual for some kids, either by grade level or by parts of the country, and say fully the other way for other kids. So it's a hodgepodge where it's anything short of entirely virtual for everybody in the country, or entirely in person exclusively for everybody in the country. Because it's a kind of blunt thing when we're, even small countries have diversity often by regions or by secondary versus primary, for example. So that's what that is.
Thank you both. So this next comment is from David Page, and I will say, David, this is something that we have talked about a lot, but the question is specifically related to whether or not the strong unions help address some staff issues. And his comment is based in that we haven't done a great job with equity in terms of instructional quality and housing and a lot of critical issues long before the pandemic. So do having strong unions help to sort of mitigate some of these concerns with the pandemic?
Beth or Annette, either one of you want to take that? It's true, we spent a lot of time talking about it, and Dave is asking a killer question as always. So
yeah. Annette, I'm going to let you
yeah, so I will only say
as the
that
education expert here, the most experience with teachers union for sure. Right?
Well, we have seen the power of the unions, right? If you look back to last fall, many parents faulted the unions in school closures that lasted through the fall because they felt that schools could be open, but for the power of our two largest teacher unions, the AFT, the American Federation of Teachers, and the NEA, the National Education Association. And so even as schools went to reopen, there were concerns because people wanted the Biden administration to mandate for the teachers unions to have vaccines for all of their members. And so the AFT came out pretty strongly saying that we will support vaccines, but we will not say that we mandate that our members should have to get vaccines. And so what you've seen is that the large majority of teachers have on their own, without a push or prod from the union, they're starting to adhere to the recommendations around vaccine mandates and mask mandates, for example. But, we've seen that unions are very powerful in this country politically. And so I think that the federal government is trying to also incorporate that partnership in its decision making. And so there are lots of people that have a critique about that in the school reopening planning. And so I'll just stay agnostic to all of that because.
Beth, are there more questions? Because I know we're running out of time. If there are more questions, I will not respond as well. And let's go to another question.
Well, I think the next question actually is really suited to your expertise, Ruth. So Jamila asks about when risk outweighs choice. So thinking about, for an example, right, schools in the South that are telling teachers to come in and teach even when have COVID-19 and there are not masks required. So can you talk a little bit about that equation, weighing that?
Yeah, of course. Yeah, that is like our world. So at the Berman Institute, we've been pretty much obsessed with that and a bunch of other questions, but that's been a central one. And not all of us agree, just like in any field, not everybody would agree about everything. But the basic principles, the sort of the considerations that matter all fall in. So I'll tell you my view, and my view is widely shared, but it's not the only view among people who do ethics and public health for a living, but it's the dominant view at this point. So there's an old tradition of recognizing that as a matter of treating people with respect, according them the dignity that human beings are entitled to, that we give a wide berth to adults, and that's my reference to children being differently situated. We give a wide berth, not only in this country. So there's this sort of debate about, is this a distinctly Western phenomenon? But if you look globally, there's a sphere of choices that are generally left to individuals to make. They're often very consequential choices. This is not universal, but where it isn't universal, it raises questions about violations of universal human rights. So for example, big choices like who you should marry, what you should be when you grow up, where you can live, how you should worship, even in places of the world where those choices are not allowed to people, it's generally viewed that it's problematic, it's morally wrong when that's the case. All right, so these are like big picture, the big sort of arcs of your life that really, really matter. As the choices become less consequential or less, then the sphere for the obligation ethically to respect, right, the individual's right to choose becomes less compelling. Similarly, so that's one dimension. It's like how morally important is the choice, right? How much does it have to do with sort of deeply held values or big consequences for a person? So for example, the decision whether to have surgery or to forgo surgery and essentially go for more conservative medical management, that's the sort of decision we generally cede to people. Okay, so that's one arc. The other arc is how self-regarding is the decision. The more the consequences of the decision fall primarily on the individual who's making the choice, the bigger the berth, the sort of sphere of letting the person decide. So you've got these two dimensions. I'm simplifying a lot, but one is how consequential is the choice, right? How important are the values that the choice is engaging? And the other is how other regarding versus self-regarding the consequences of the choices are. Then you put the two together and you try to sort through in any particular, now I'll take it back to our world, public health context, where a particular decision falls. And some of both of those, some of that second issue is empirically ascertainable, right? So the first one, in terms of how important on a values spectrum is the choice, that's not something you can empirically test, right? Or adduce evidence about. You have to have sort of shared consensus around what are the really important values and choices that matter to people, right? What are more important, what are less important kinds of value-based decisions. How does it affect other people? We adduce evidence to help assess that, right? So if you look back at what happened with tobacco policy or seatbelts or any number of things, there are all kinds of justified contexts in which we say to people, sorry, right? The choice you want to make has too significant a set of consequences for other people, and they can't adequately protect themselves from your choices. And that's where we are in the vaccine and mask space. We've been there for a while. Some of us have argued for some considerable period of time that we should be mandating vaccines for more and more populations, certainly mandating masks. But that's the short answer to your question is that's kind of structure of the ethics framework in which you would consider these things, and then you sit there and you start trying to map out on those two dimensions where something like a mandatory vaccine policy for school staff or for students lie, right? And it does matter a lot, right? When you get to children, the sort of difficult navigating space, and I'll stop here, but I don't know how many of you have been asked to comment on constraints on adolescents who want to be vaccinated, whose parents are not authorizing them, the differences across the states, willingness to give the kinds of choice options to adolescents say that they have in the sexual health arena, right, to COVID vaccine. So there's that.
Thanks, Ruth. I want to just shift real quick, because this actually is something we were chatting about yesterday afternoon, in terms of vaccine, the labor policy and how that influences vaccine mandates for teachers and school staff. So someone asks if that will apply to schools.
Will it apply or should it apply? Those are two different, right, as you know, they're like two really, people ask you and me and Annette and many of the people on this call, should it apply, right? Whether it, whether it legally does or by the nature of the order it does.
So by the nature of the order, right, as workplaces with over 100 individuals, do the vaccine mandates apply to schools?
I think so, right? Look, I mean, I'm looking at Annette, but I don't, Nancy Cass and I, some of you may know Nancy as well, my dear colleague in the Berman Institute and in HPM at the school, have sort of been working on defending the position that it should go well below to small employers as well as big employers. I don't know how you can understand a school except as a large employer, right? That has 100 plus, right, Annette? I mean, what is it? There's no, I don't know.
I agree.
We should ask our health law colleagues whether there are any carve-outs, OSHA carve-outs for schools. I don't know if there are, but if this is going to be an OSHA administered regulation, I don't know. Right?
I think where this gets interesting and where we were talking yesterday is we're looking across the states to look at what policies are currently in place, what court cases are currently being adjudicated for the different states around some of these policies. So so that it seems like the answer to this question should be very clear. It's a little less clear currently.
What else is new in this pandemic, right? The search for clarity is a very Don Quixote thing right now. I mean, eventually someone's going to decide, and whether they can decide nationally or they decide, state by state. But Annette, are there many schools that have more than 100 employees in the United States? Would you guess?
Well, it depends, because, when you have to ask yourself, so people are employees of the district, not of a school.
Right. Is it the district or of the school?
Right. So that's where I think there is the splicing.
One of the things I should mention, the kind of conceptualization of who counts as an employee and employer, and if it's the district, so it's the district, right? I don't see how, if it's the district, I don't know, right, that there's any district in the United States that has fewer than 100 employees. Maybe. I do know this other thing that we're doing that will be up shortly that might be of interest to some of you, all of which, when Annette was saying, please look at our historical as well as our current stuff. It's because we're hoping that people will use the resources, the data that we've collected later, whatever, to do some really good, interesting research that can help inform school policy and public health, child health policy going forward. But we've started a project where we picked 56 canaries in the cage, 56 school districts across the country. I won't go through the methodology now because it'll take too long, but they are 56 countries that are supposed to represent the different regions of the country and also very large school districts, high poverty school by multiple metrics, high poverty school districts and low poverty school districts. And we're going to be looking intensively at what we have started already. The data will be up hopefully. And this is one of the reasons why a shout out to Andrew Nicklin. Without Andrew, they would be sitting there for like years waiting, but they should come up, I think, this week sometime, if not next week. So we'll be monitoring and have been, we just haven't put the data up, as I said, these 56 school districts really carefully to see what happens to them over the course of this year at minimum. And hopefully this will be, sort of a data set that lots of people can look to for whatever kinds of research questions they might want to ask about the impact of this year, right, in terms of recovery, quote unquote. hopefully people will find this useful. We're excited about looking at the data ourselves, but we're also excited about other people visiting the website and using it with us or on their own, whatever. On the last comment, and then before I go on, I'm so sorry, on the equity issue, David, that you raised. Look, we all know this, right? The world was profoundly unjust globally and nationally before the pandemic, right? We can all just see that. And the pandemic has just made all of those inequities that much worse. So the question then becomes, what does recovery even look like, right? Going to baseline takes you back to bad, right? Takes you back to unjust. So are we going to be, and this is the whole question, the Biden sort of build back better stuff? Well, it's a build back more justly is one way of understanding better, right? And there is great push to that. And I know so many people in this department in particular are committed to doing just that globally as well as in the US, both for child and maternal health. So on the maternal health side, just to say we have another tracker that is looking at vaccine policies and pregnancy. If anybody is interested in that, we can put that up. I'll put that up in the chat before I go. But just that to us is the challenge, right? It's a challenge for all of us. It's not going back to baseline because it's like Annette was saying, too many parents have come to realization that what they were putting up with before for their kids was just so unjust and unsafe, and they don't want to go back to that. So just, putting your kid back in school is not good enough, right? Because it was pretty bad before and we just didn't know how to envision an alternative. Now we've had a year of an alternative and we don't need to settle, right? If that comes out of this pandemic, that would be great. I'm going to do the Irish goodbye and slip away in a second and let the conversation keep going.
Thank you. Thank you so much for being with us today. There are a couple more questions, Dr. Anderson, so if you're okay hanging on for a couple more.
Absolutely.
Try and cover. One is from Phil Leaf. He's asking about suggestions around the best ways to incorporate youth voice and involve students with implementation and monitoring of outcomes. And before I turn it over to Dr. Anderson, I will say, kind of looking across the American recovery plans, you don't see a lot of focus on young people and getting young people's input on those plans, on what the next steps are, which is really unfortunate. But I do like to take as many opportunities as possible to shout out when I think city schools are doing things well. Nothing's perfect, but today on their website, they'll be releasing the results of some end of year surveys they did around sort of the future of city schools, their 3 R's plan. And I'm not going to remember what all the R's stand for right now. But one of the things that they ask about is credit recovery and learning loss. And, they had big plans about how they want to extend the school day and, extend the school week. And they asked young people, and they were really clear, they're not planning to come to school on the weekends. And so they did get a pretty good response from young people. And, I think we need a lot more of that. We need to, prioritize that young people's voices in this conversation is really important. There's a lot of anxiety for young people about returning to buildings, both around the health and safety and around all of the issues that were present in the schools before the pandemic. So I don't have a great answer in terms of how we do more of it, except that we continue to prioritize it in the work that we're doing and share that work, because I think it is really important. They should have a very large voice in these conversations, and across the country they don't at this point.
Yeah, I was just going to also jump in back to mention, you actually connected us with the Baltimore City Health Department last spring. And so there's another project that I'm part of with Dr. Megan Collins called HEAT, the Hopkins Education and Training Corps. And we worked with Panagas Galiot-Sados and several other members faculty members and staff across the university. It's a very collaborative effort. And I think that's one of the good things that I've seen through this pandemic is that there has been such a willingness across units in Hopkins for people to work collaboratively. eSchool Plus represents one of those, but this HEAT project also represents another opportunity. We have Mindy Levin from Source, who has come and joined this effort as well. So there are quite a few of us who have created this HEAT team, and we have, over this past year, we've started delivering curriculum around COVID and COVID-related topics directly into city schools. And so we have now gotten a grant because, again, Beth has connected us with the Baltimore City Health Department through the Office of Minority Health to help to prepare our young people in city schools to become health ambassadors around this whole COVID hesitancy. And so to your question, Phil, I think what we're trying to do is move the needle from vaccine hesitancy to vaccine confidence. And so as we are working with our students, as we said, only about half, just slightly under half of the students who are eligible for vaccines in Baltimore City have them right now. And so we know we still have a role in helping to try to get that to closer to 80%. And so part of what we are going to do is to try to address some of the concerns that we know the young people have raised around issues like mental health, around issues like the mRNA, around issues like infertility, around issues like what it means to get the vaccine with the side effects, so that we can try to be a bridge for students and help them to go back into their communities and spread the word about the vaccine, because there's still lots of conversations being had in many households about vaccine, including my own, to be completely transparent. I have a household that is mostly vaccinated, but I do have a spouse who is not vaccinated. And so we're having constant conversations about this. This is historical. And, it's interesting as you raised Beth earlier, and in our community, there are lots of conversations that are happening in our community centers, in our senior centers, in our churches, for example, that those are the places that we know the barbershop where people are talking about all of these things. And so we've got to be able to reach our young people in the schools, as well as all of these other places where we know our young people will be, to help them to become ambassadors and to start talking about what it means to be more vaccine confident. And so that's part of what we're trying to do through our HEAT core mission.
Thanks, Annette. I'm going to raise up one last comment. Emily commented about whether or not we're going back to the states around the school reopening and some of the components to see sort of what the current state is for those districts. And I will say, in part, some of this is covered through some analysis we're working on currently in the American Recovery Plans, and looking at some of those similar components to see how they're showing up in those plans. And that is, again, at the state level and not at the district level. Like Dr. Faden was talking about the other analysis that will be up on our site soon. Mm-hmm. The challenge with it, as with all of education work, is that education is very, very local. So we're looking at sort of state level plans, but there is often a big jump from what happens at the state level, what the district says is going to happen, and then what we see at a school level implementation. But I do think that'll give us an opportunity to revisit some of those components and see where we are at this point in the pandemic. And Annette, I will give you the last word.
Well, I would also just tag on to that to say there's been a lot of money at the federal level flowing into our states and local districts and into classrooms. The question remains, and for those of us who've been in this ed reform space for the last, well, I'm 21, so I wouldn't say 30 years, but for those of us who've been in this space for the last few years, we know that just having the dollars flow into the spaces does not automatically translate into change. And so I think we've got to take the funding. This is a historic level of funding that is meant to help to push the levers of change around education reform. But I don't know that we've had very much clarity. There's been such a rush to get the dollars there that there hasn't been necessarily the same amount of clarity around the actual prospective policy changes and the levers that we're hoping to see changed. And so even as we're seeing a lot of money for things like tutoring and after school programming, to your point, we don't know that students are going to show up for tutoring. Are students going to show up for after school? One of the things that we have really had to reckon with here in Baltimore in particular is that as many parents lost their jobs during the early days of the COVID crisis, it was their children that often had to step in and get jobs. Many of them were going to school while they were also working shifts at big box stores, for example. And so we have seen a shift, and we've addressed that even in our eSchool Plus work. Dr. Sarah Johnson and I co-published a op-ed talking about how we really need to rethink how we're looking at things like attendance, for example, and mastery of content, because our young people are being pulled into so many different conversations around how they're supporting their families, as well as how they're thinking about their futures. And schools are systems, and systems are hard to change. And so just having this historic level of funding pushed into schools does not necessarily mean that there will be change, because the systems are so hard. The levers of change in schools are so hard to change. But we should be thinking about what kinds of outcomes we expect to see because of all of this funding. And so at the end of the day, if we have not seen change after all of this, then the question remains, what else do we need to do? Because our children deserve it. If we look at our most vulnerable children, it's estimated that up to 3 million of those children across the country have missed some portion of their school year in the last year. And we need to think about what restoration looks like, what interventions look like. For those who were there and still had a tough year in virtual schooling, we need to figure out how we intervene with those students and support them. We've seen these CARES Act dollars, for example, go to support things like buying more staff, social workers, school counselors, school psychologists. But we don't necessarily know that there is a strategic plan at being able to support the mental health of our students as we return to in-person learning. So all of this really suggests that we need to map out a strategy to ensure that our most vulnerable students don't get missed in this reopening. And I think that that is a clarion call for all of us who are in this work together, including everyone who's on this Zoom, to rethink what we have been doing so far to support equity efforts in our schools.
All right. Thank you very much for that last word, Dr. Anderson. Thank you all for joining us today. If you have additional questions, feel free to reach out. I will put you in touch with Dr. Anderson or Dr. Faden, or visit the website, and please connect with us. We're always doing a lot of work. There is always a lot of room for more hands. So thank you all.